Hello, I'm Greg Jamian, and welcome to Home Health Care Corner. As more people receive their medical services and care at home, there are many questions that pop up that sometimes require quick answers. I have put together a series of short segments with healthcare professionals that will help explain how things work, along with answers to common questions found in home-based care. I hope you find the following information helpful.
Hi, my name is Janet. I'm a clinical supervisor at AmeriStaff Home Health Care Company, and we're here today to talk to you about safe transfer techniques. I brought in an expert on the topic. This is Macks. She's one of our physical therapists, and she's going to show us how to properly transfer your loved ones at home. And my big question is, why is it so important to transfer somebody safely? What does that mean?
Well, you want to make sure that they're safe. You want to prevent injury. The most important thing is to prevent injury to your loved one and also to yourself. You need to know how to do it safely to protect them and to protect yourself.
Okay. And I'm sure there's a lot of things that people do wrong every day in the home. So that's why we brought you in today to kind of explain the proper way to put on a gait belt and transfer somebody to a wheelchair and use of a sliding board. So we're going to go over those techniques today. So we'll get started. Ann, can you show me how to put a gait belt on? And what's the purpose of a gait belt?
A gait belt is very important, especially if somebody needs a lot of help to transfer. If you're not using a gait belt and you're trying to transfer someone and they start to fall, what are you going to do? You're going to grab their arm, maybe grab around the ribs. You can definitely injure their arm, injure their ribs, especially if they're very frail. Women with osteoporosis, their bones are weaker. So you really want to avoid doing that.
And some of the types of injuries would be like a skin tear. I know people get skin tears when they like grabbing, because they're preventing their loved one and they're just grabbing them. Shoulder fractures, fractured ribs, all kinds of things. So that's why it's very important if somebody's pretty weak to use one of these belts.
Yes.
What does the belt do for you?
The belt lets you hold, the belt around the waist is the ideal position for a belt, and I'll demonstrate. But it allows you to have a good control of the person so that if they do start to fall, you can really hold and support them without putting any pressure on their arms, their ribs, things like that.
That's what they say, what they mean by a controlled fall, right? Because the person's still going to fall, but you're controlling that they're not getting as hurt.
Yes, ideally you can even prevent the fall. If they're just starting to fall and you can hold them and help them to regain their balance and their support. But if they are, if they're too big or the fall is too hard, then yes, then you can help control the fall, lowering them slowly to the floor, the couch, whatever's nearby, to prevent injury or to minimize injury.
Perfect, good. Okay.
Okay.
Can you show me how to put one of those on properly? Because I know probably us nurses use them the wrong way. So.
There are different types of gait belts. This is my favorite buckle because I feel it's the strongest. There are also the kinds that just clip together. But
like a seat belt.
Yes. But I like this metal with the teeth. And the important thing is you want the teeth, you do not want to put it in back here, okay? You want the teeth up, and you thread this end up under and pull it through, and then you go over the teeth and put it in like that. Then the teeth catch, and it's very, very strong. This will not come loose on you. This is very strong and very tight.
Okay. You want to put it on me and show how it works?
And again, ideally, you always want to put it around the waist, and you want it very snug. If you cannot do it around the waist, sometimes people are large or have a feeding tube, or if there's some reason that it cannot go around the waist, it's also acceptable to put it around the chest, under the armpits.
Okay.
But again, the first choice is always the waist.
Okay.
So I'm going to put it, remember I want to feed it through my teeth, so I'm going to put it so the teeth are this way.
One of the therapists I use told me always have this tag out, this part, because most people think this has to go on the inside, but on this belt, the tag goes on the outside.
Okay, so again, I've got it like this, and I'm feeding it up under. Okay, and I'm gonna put it on fairly snug, and then feed it through this end of the buckle. And I'm gonna tuck it in here. This belt is not so long. Sometimes they're very long and they'll hang down.
And you'd worry about them tripping over that part, right?
Right. And then if you need to tighten it, now, so right now it's pretty good, but you can easily tighten it by just pulling on this end and then pull it through there. Did that feel like, did you feel it get a little tighter? Yeah. And again, you just want to be able to get 4 fingers in there. You don't want it too loose, because then if they start to fall, it'll just pull up on the person.
And the trick is to know how, if it's too tight or too loose, is to put 2 fingers on each side or 4 fingers underneath.
Like that. Yes. Yeah, like 2 fingers on the side like that, or I always check with the 4 fingers under it.
What's the difference between, I've heard a gait belt and a transfer belt? Like the transfer ones with that have the loops on the side?
Oh, yes. It's a different style of belt, and it has loops for you to hold so that you're not, I'm putting my hand under the belt and using the belt like that. The transfer belts have loops that you hold the loops instead.
Okay. Do you know what the advantage is, the loops, compared to your hands?
I honestly prefer this. Maybe if you have very large hands, maybe the loops would be helpful.
Okay. All right.
Okay.
All right. So first transfer we're going to demonstrate is to use a sliding board. Why would you use a sliding board?
A sliding board is very important if the person does not have leg strength. If for some reason they cannot stand on the legs, either due to the weakness, severe weakness or paralysis, or if they have a broken leg and they can't bear weight on the leg.
Or a quadriplegic that has, lost the feeling of all of their legs and they have no control, you'd want to use it with them. Right. Okay.
Okay.
Or somebody maybe that's not supposed to bear weight on their legs for like a fracture or something like that. Okay.
Good. So the first thing you want to do is get your chair positioned properly. And it's really the best if you remove the leg rests. And the way that you do that, on this style of chair, which is very common, is flip these up and then release it. And once it's back, then you can just lift it off. Okay, you cannot lift it off until it's back all the way. Let me show on this one. And then the same thing. Here's the release button. Fold it up, release button, and then once it's back, and then you take it off. Now for a sliding board...
And why is it easier when the leg rests off?
Oh, because then you're not tripping up at all.
And you can get it closer to the patient too,
yes,
right?
Yes, definitely.
Okay.
Now for a sliding board, you also want to remove this armrest. There it goes.
There.
So we'll just move those. And when you take things off, just make sure they're out of the way so again you don't trip and the client doesn't trip. One thing before any kind of transfer, I want to talk about body mechanics. Body mechanics are very, very important to protect yourself and to protect your loved one. So keys to good body mechanics when you're transferring someone, you want to be in close to them. You don't want to be transferring like this. That puts a lot of strain on your arms, your neck, your back. So you want to be in close. You want to have a good base of support. So you want your feet to be about shoulder width apart. And also you want their feet to be flat on the floor and straight too, especially if they're going to be standing, so that they have a base of support also.
And they shouldn't be having stocking feet because they could slip with that unless they have those socks with the grippers on the bottom.
Right.
And otherwise you want them to have shoes that aren't going to slip out from underneath
Right.
them, right, when you're trying to transfer them.
Yes, very good. And then it's also very important, everyone talks about core strength and trunk strength, and it really is important. The abdominals really, really do protect your back. So it's very important before you do any lifting, you want to tighten and set your core. You want to tighten up your tummy muscles and protect your back. It's very important.
So squeeze those belly muscles.
And you want to always bend at the knees, okay? So you never want to lift like this. Very bad for your back. So you want to bend and always lift with your knees, and you don't want to twist, okay? If you need to, you want to twist like this, like pivot your whole body so you're staying straight. You don't want to do this. Very, very bad for the back.
Okay.
So those are keys to protect yourself. So for the sliding board transfer, now we want to get the chair positioned in correctly. So you want to go at about a 45-degree angle as close to the surface and to the person as you can. Always lock the brakes. Very, very, very important. You don't want that chair to scoot out on you.
So you just flip this handle down to put the brakes on. Okay.
Right. And again, some chairs are different, but on this chair, yes. But you should always know how to lock your brakes.
This is a typical chair though, right?
Yes. Okay. Now, ideally with a sliding board, like we're going to be going from a low surface up to a higher surface. Ideally, you want gravity to help you. So we're going opposite gravity here, but if you can at least be level, either level or going down is a much easier with the sliding board.
So what if I was in a home that had a low couch like this one is? What would I do? What would be the techniques or something that you might do to make this a higher surface?
I know you can purchase risers for the legs to elevate the whole sofa.
Okay.
They have them for beds too if your bed is low.
Okay. All right.
Okay.
I also saw one of the therapists gave me a trick where they put like another cushion underneath the cushion or blankets even to raise this up so it was more of a level that they could transfer.
Good, very good. So with the sliding board, and I'm going to have to come in here now for this. So with the sliding board, you want to get it under her hip like that and then onto about the center of the chair. So the gait belt is already on. So Janet, I'm going to have you just lean over. We'll position it under the hip, if you can see that. And I'm going to bring the chair in. I had slid it out a little bit. I'm going to bring it back in.
So how much of the board is under my hip? Maybe 2 inches?
A little more. You want it about to right here on your hip. Okay.
Right. And then this should be in the middle of the wheelchair.
Yes.
Okay.
Okay. And again, she has her gait belt on already. It's good and snug. And I'm going to move in close, tighten my core, bend here. I've got my base of support. Very, very important.
So it's okay, you can turn your back to the camera and just do how you normally would now.
Okay, so, and I like to go under the arms. And brakes are locked. I always double check that because you don't want that to slide out from you. Okay, are you ready? On the count of 3, slide over. 1, 2, 3.
So we kind of use that board as like a slippery surface to help move, so reduces the friction. So that was pretty easy, actually.
Good, good. And then once you're in, reach for this and lean, and we can remove the board. And you may need to just help reposition a little bit. Okay? And then once she's in, you'll replace the armrest, okay, and the leg rests, and make sure the feet are positioned properly.
Okay, so if I'm going back to the couch, this way you're going down, so it should be a little easier, right?
Much easier. Okay, and then the same thing, you lean, and again put it under about one hip, one side. And now as she goes down, the board will go down. One thing that's very, very important is make sure that the loved one never grabs the end of the board, because as you go down, it's gonna pinch your fingers and that will hurt.
Would it be safer for them to like even hold on to you, because that would avoid
Yes.
that tendency to grab that board? Okay.
Yes. Okay. Do you want to demonstrate?
Yep.
Okay.
So would I grab on?
Yep. You can hold on there
Okay.
to push with that one, but this hand, yes.
So you always try and have them help you as much as possible, right?
Yes.
Okay.
Yes. Okay. Are you ready? Mm-hmm. Okay. On the count of 3. 1, 2, 3. Okay. And then lean. Pull it out. Okay.
Yeah, that was very easy.
Good.
Thank you.
Yeah, sliding boards are really, really very, very helpful tools for people who can't stand.
This is another type of sliding board too that people use. I know that we keep it in stock at our company, Sun Medical. So.
Yeah, and this one, the person would sit on this, and then this actually slides. Oops, I'm sorry, I'm holding it, so it's not sliding right now. But when the client is sitting on it, it'll slide like that.
Okay, but you'd have to get them right on the middle of that to slide
Yes,
first.
yes.
Okay.
And probably they can't be I mean, they have to be about this, size, and a little bigger is good, but it's fine.
But that little one seems to work. It's kind of like the universal one. Anyone can fit on that. Okay.
Right.
All right. All right. And then how do you transfer if you don't need a sliding board? Like somebody can use their legs a little bit. Maybe they're just a little weak. They have some thing, or maybe they've had a stroke and their left side is weak. How would you do that?
Okay, I'm going to put the armrest back on because it's very helpful, because then they can use it.
So this is somebody that has some control in there.
Yes. Okay. So again, you're going to take the leg rests off and position it. We want to angle it at a 45-degree angle and make sure the brakes are locked. Always very, very important to make sure the brakes are locked. If someone's had a stroke, you want to transfer to the strong side. Okay,
So
she
this
said,
leg is weak from the stroke, so you always want to then, this would be my strong side then. Okay. And why do you want to do that?
so that they can use their strong leg to stand on to help.
Okay.
Okay, and their strong arm to reach
Oh, perfect.
too. Okay. When someone's going to be standing, it's very important then also to have them, again, make sure their feet are positioned. And then you want them to scoot to the edge of the seat, okay? So if you scoot forward. Okay, good, very good. And have the feet positioned. Now, because I know her left leg is weak, I'm gonna brace it a little bit for her.
And what do you mean by brace it?
I'm gonna have my legs so that if this leg were to buckle, I would be able to give it some support.
Okay.
Okay, and again, I want the chair nice and close so she doesn't have to go far.
And if you have somebody that both legs are weak, maybe just from deconditioning or anything, do you block both?
Yes, like, I don't know if the camera can see, but like this.
Okay.
Okay,
So you put your knees on the outside of both if both legs are weak. But if you know one leg from a stroke or something, then you just use that one leg. Okay,
Yes.
makes sense.
okay. And when someone's going to stand up, do you mind if I sit for just a moment? It's so important. I find a lot of people, after they've had some kind of a stroke or problem, they try to stand up like this. They're trying to get up like that. It's very important to get your weight forward before standing up. So one little trick or tip I use is to tell them to get their nose over their toes, okay? So meaning like this, you want to lean forward to get your weight forward, and then it's so much easier to stand up.
Okay.
All right?
Makes
sense. So Janet, if you can get your nose over your toes, and then on the count of 3, we'll stand up. And I want you to reach for this armrest, okay?
And the counting thing kind of helps them to know when you're gonna.
Yes, so the timing, so you're communicating with them and getting the timing right.
Sounds great.
Okay. So again, I'm supporting this, and again, I'm tightening, got my base of support. Very important to develop that as a habit. Anytime you want to help lift them, always protect yourself.
Because
ready?
you don't need a back injury when you're trying to help your loved one, right?
Right.
Because then you're both out of commission.
Right. Okay, so on the count of 3, ready? 1, 2, 3, and stand up. Good, and then reach for the arm. Good. Now, since I know this leg is weak, always make sure to position properly. Okay? Now, normally if you'd had a stroke on this side, I would turn the chair again so that we're going towards your strong side.
Perfect.
Should I go ahead and do that now? Okay. Do you mind just picking up your feet? Again, we'd have the leg rests on, and
Normally, if you are moving the wheelchair, right?
so this way she'll be going to her strong side. So lock the brakes. The number 1 rule, always, always, always make sure those brakes are locked. Okay? Now this time she'll be able to push up on here, but again you want to scoot to the edge of the chair. Good. Okay? And then on the count of 3, you ready? Remember, nose over your toes. 1, 2, 3, and stand up.
And direct them to reach for.
Good. Yes.
Right. Okay. All right.
Okay, how did that feel?
Great.
Good, good. All right, and then I'm going to move the chair. And again, make sure her feet are positioned properly. And I want to show how to put the leg rest back on the chair. So again, this is a standard chair. It's a little tricky. You have to, again, you have to have it at this back position in order to do it. And then you just line it up.
On those posts?
Yes, yes. If you see the post, you line it on the post and then it'll swing in. And again, if someone's in, you want to make sure it's locked. So make sure it's locked on.
Okay.
Okay.
Thank you so much, Ann. We appreciate it. All the helpful tips you've given us today. If you have any further questions, you can always call AmeriStaff at 248-288-2270. Thank you.